Hi, this is Brian Wormers, and today I get to talk to you about your poster that you'll have for Nursing Capstone. Underneath the assignment, you're going to see a couple of different things. The first one will be a poster submission. This is where you're going to upload a PDF. I can't stress that enough. I need a PDF of your poster presentation. I'm going to put it on a zip drive, and I'm going to take it to Staples, and the College of Nursing will pay to have your poster made for you. And I will take it down there, I will bring them all back, and you don't have to do any of that legwork. But you have to have it turned in on January 31st at 8 a.m. in a PDF file into the correct area. Now, you also have to have a recording of this. This recording, I do want you to be a good presentation of your poster. Within this, I want you to have a recording, and it's going to cover all the major areas, and we're going to get into this in a little bit. This is what we're going to grade your content of your poster presentation on as your faculty for this course. And then on February 6th at noon in Jeske, you'll be doing this presentation to the community, and we're going to record and look at your professionalism during that time. So you have to dress professionally with this and be able to speak to your poster and present it in a professional manner, including having your references available if people want them. So specifically, let's look at some of these details of the poster presentation. So for your presentation's poster submission, you will have a poster template, and this is what you need to use. Use this template, that way it is standardized amongst everybody. You can change minor things throughout this, but this will give you a good template to use so it's the right size, and so you have a good understanding of what needs to be covered on these. So background, nursing assessment, diagnosis, planning, implementation, evaluation are some of the main things. So easy to do, simple template for you to use. That being said, other things that we want to cover with this one, we will cover our goal of this Nursing Capstone poster, and then we'll go into, and I'll review this rubric with you. So looking at this, if I can get the zoom quite right. So this is your case study poster. So you're going to be looking at standards of professional nursing practice within this. And so we really want to see what you did during your preceptorship. This is going to be a case study, so you're going to tell us about one patient. You're going to tell us very in-depth things about this patient. You are going to also make sure that we cannot tell who your patient is. Your presentation can be used. You can use this one-button recording studio in the Mirrors Library if you want to, but you do not have to for this one. You could use it in a variety of different settings. You could do a YouTube video of it. You can do, audio recording, something like that. So your recorded presentation can be done in a variety of different modalities, and that will be up to your discretion. So within this, we want you to have, you're going to focus on the case study. None of you have got travel experiences this semester. And so we're going to look at that patient, and you're going to select, all about it. Protecting patient privacy, so you can't be saying names, specific ages. We don't want to know, this is a patient from Lamar's, Iowa, or anything like that. So you're going to be like, I was on a pediatric unit in a Midwest hospital, and this is the patient that I saw. This patient came in, had these signs and symptoms, etc., etc. But you're not giving names, you're not giving birth dates, you're not giving specifics that could identify this patient, including, the town that they're from, or, specific things about them. So within this, we do want you to have a history. So what brought on this illness, or what was occurring with your patient, what's your primary diagnosis, and any secondary diagnoses. This could be multiple. Pertinent family history, medication history, nutritional history, functional history. What was your nursing exam like? What did you all see? What were the areas what were your findings? What was normal? What was abnormal? Diagnostics, including labs, CTs, MRIs, any of those kind of things. With that, I don't expect you to put that on your poster. You might be able to. I mean, if you Sweet Talk Radiology, they might give you a an image and then you could black out the student name or the patient's name. Sometimes they'll do that. But that is kind of going above and beyond. I don't expect that. But we do want to know labs. We do want to know findings. We want to know, what did they see on the MRI? What did they see on the chest x-ray? Those kind of situations. What medications were prescribed? What were the indications? Why did they have them? We talked about diagnostics already. Not just that they had them, but what were the findings and how does that relate to your patient? None of you've got populations, so you don't have to worry about that. Nursing diagnoses, one of which has to be a psychosocial diagnosis. But you need the top 3 priority nursing diagnoses. This does not mean, patients at risk for falls or patients at risk for skin integrity issues. Yes, that is everybody in the hospital. I agree. Get beyond that. You are at a high level and you're about to graduate. We really want to know that you can be focusing and hit those high level things that are the top priority for your patient. Planning and outcomes, address the following. What were the main things that you needed to address? What are your short-term and long-term goals? Use SMART outcomes. So specific. Patients are going to be able to do this by this time frame. Was it measurable? Can you say, yes, they did walk the hall 4 different times in my shift? Is it achievable? Is it something that the patient actually can do? Is it relevant? Like I said before, just because they're at risk for skin breakdown and falls doesn't mean that those are the top priorities and the things that you should be making outcomes for. So really tailor it into your patient and make it, you really want the top diagnoses that you have to work with this patient. Should have 2 outcomes per nursing diagnosis. And so if you get 3 nursing diagnoses, then you should have a total of 6 of these outcomes. They can be short-term, they can be long-term. You can be looking at this as within my shift, or prior to discharge, or a year from now. So it kind of depends on your situation and what your outcomes are going to be. But make sure that you've got that time frame on there so we understand it. What's your implementation? What interventions did you do? Address those nursing diagnosis and outcomes. What's the health promotion and the disease prevention that you could have done or helped with this, if at all possible? What cultural considerations were implemented? How did you help the patient in this regard? How did you coordinate care of concerns? What groups did you work with? Did you work with a physician, an RT, physical therapist, occupational therapist, speech therapist, etc., 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 respiratory therapists, social workers? I mean, the list goes on and on. But we want to know about how you worked with other people in coordinated care, because that's a big part of nursing. Evaluation, consider your outcomes. Did you meet your interventions? Were they effective? Were they appropriate? Would have you changed anything? We've all had the best laid plans, and then something happens and, that this wasn't actually a priority. Sometimes we look back and say, hey, we need to adapt this, we need to change this, and we have to refocus. Was your outcome achieved? Don't get caught up on this one. Like, if you don't achieve your outcome, it means you failed. No, it just means that your patient wasn't to that level yet. Something happened along the way. Your outcome needed to change. But you can be quite honest about this. And just, if you didn't make it, that doesn't mean that you were not good as a nurse. So don't have that on your shoulders. But you do have to look back at it and see if they made it or not. And if not, then what are we going to do different? So remember HIPAA. I've said this before, but do not break any HIPAA things. If you are including unit in hospital, in patient name and birth date, or any of those type of things where I can kind of tell what patient this is, where they were from, you will fail this assignment. We take HIPAA very carefully. We don't want somebody walking by from a small town going, oh yeah, that was my uncle. Hopefully they won't be able to understand the details of your patient or somebody that's in that small town environment. We really want to keep that confidential, or at least try to be fairly vague. We were in an emergency room in the Midwest. Okay, that could have been Chicago to wherever Kansas City, who knows. But keep it kind of vague. We want the specifics, the labs, the stuff like that can be very specific on this. But we want to protect that patient's privacy. So that's what we're shooting for with this presentation. Now, specifically looking at the grading rubric, this is your nursing assessment. Did you do this? Did you have a physical assessment? Did you document your medications and their indications? Why? Did we have the diagnostics on there, giving results? And for your presentation, I really want you to know what those results mean. Okay, so the hemoglobin was slightly high. Does that mean anything? Was that just an incidental finding? Did it have anything to do with your patient? So, and we're looking at this. Was it exemplary? Was it masters? Was it proficient? Was it unclear? Or was it, inadequate? And so we'll kind of go through that with all these different sections. Nursing diagnosis. 3 top priority nursing diagnosis. Once again, this is not skin breakdown or risk for falls. You really want to have those top 3 nursing ones that we have to deal with. One of which is going to be a psychosocial diagnosis. And we're looking for all these things on here. Planning wise, did you have the priority needs? Did you have SMART goals and SMART outcomes? Did you meet all these? Implementation. So what did you do? What was your nursing diagnosis? What's the outcomes? What did you do for health promotion, disease prevention considerations? What's your cultural considerations? And what's your coordination of care? Did you talk about all these things? Evaluation. Was it effective? If it wasn't, that's all right. Like I said before, that doesn't mean that you're a good nurse or a bad nurse. Sometimes plans change. What would have you changed? Did you need to adjust this? Do we need to fix this? Was the outcome achieved or not? We'll look at the graphics. How's your poster look? So yes, I'm printing it off. It should look professional from Staples or wherever I take this to. But you're going to be filling this in. Can you see it from a ways away? Is it clear? Is it concise? Is it free from any grammatical errors? I am not proofing these posters. You need to do that before I go print them off. If you have any concerns, have a friend look at it. Have somebody else go through it. I highly recommend that you have 1, if not 2 people look at your poster presentation, check for grammatical errors, make sure it's clear, make sure it's easy to read, and visual pleasing to your audience. You've got a great template to start with, but this is up to you. Have your references, be able to hand them out to people if they ask for it. We will print this out, and it's going to be bigger than the 11 by 14. And we'll go from there. One Button Studio, this is an option for you, but this does not have to be what you utilize. So we want you to be speaking logically, fluently, clearly. So realize, this is the title of it. You may use One Button Studio over in the library, but you do not have to. But all these things will apply. Was it clearly articulated? Did you utilize the nursing process? Did you, during your presentation at Jeske, how was your manner? How was your nonverbals? Were you acting confident? Were you dressed appropriately? Were you able to talk about your patient and not just simply read from your poster? So, that being said, this is kind of an overview of that case study poster. If you have questions with any of this, please talk to your faculty. We're happy to help you with this. And I'm looking forward to it. I think it's going to be fun. I really want to hear about all your great experiences, and I can't wait for you to share it with the rest of the community. So, all right. Enjoy doing this. It'll be fun.